Dear friends, I have been seeing so many patients with knee pain, osteoarthritis of knee joint, especially elderly people, right? I have seen more of my village patients, rural patients. They cannot afford surgeries. Total replacement is a very costly affair for them. They cannot afford. And some people they do afford, but affordability is there, but they cannot. They are very much afraid of surgery. They don't want any surgeries, or they are not fit for surgery. They have got uncontrolled diabetes, or they have obese, too much of obesity is there. So many reasons are that people won't get operated, right? So if that is the case, how to lead a life relatively painless? Okay, so I am giving very good small tips to do some changes in their activities of day-to-day lifestyle, which is called as ADL activities. If they modify these activities, it will be very, very comfortable for them. Life will be very comfortable. The wear and tear of the knee joint will reduce. The pain will definitely reduce. Okay, simple tips like suppose if elderly people with knee pain are there, please ask them to be in their ground floor. Of course, that's a common sense, but do follow it. Okay, so let them be in the ground floor. Let them not be in the duplex house in the top floor or first floor, second floor. Their rooms, their room should be in the ground floor only. And definitely, if you are planning for a house, definitely keep one room or two rooms in the ground floor only, because suppose if you sustain any fracture, any fracture, ankle fracture, whatever it is, it's very, very difficult to shift the patient to rooms, right? In the small steps, you cannot take the stretcher, you cannot even take your wheelchair also. So see that one room will be there definitely in the ground floor. This is for emergency purpose, especially for the elders. Okay, let them be there. And whenever they are climbing the stairs, if the size of the steps are very small, means very convenient. If there is a ramp, that will be much more convenient for them. If it is possible to create a ramp, it's well and good. If not, let them use the side bars, right? So you have seen in malls everywhere they would have put the side bars. So whenever the patient with knee pain or hip pain, whatever the pain, so they can take the help of those side bars. They can hold them so that they will put a lot of weight. They will transfer that, and then they can climb the stairs or climb down the steps. It will be very, very comfortable, and pain will be less, and they feel much more comfortable when they shift their weight to the side bars there, right? If not, they can use it definitely walking stick, tripod, all those things they can use. If there is severe pain, they can use if there is deformed knee, they can use a walker also, right? So that will be a very, very convenient thing to ambulate for the patients, right? And if they want to sit on the latrine, is a very, very big problem, especially in the rural areas. If they have got the Indian type of latrine now, it's very difficult to sit there. If they sit down, it will be very difficult to get up also. So what to do? If it is possible, if you change your Indian type latrine to foreign type latrine, that will be very important. That will be very, very, very convenient one for the patient with the knee pain, right? So if you use the commode, right, foreign type of commode, wherein they can sit comfortably and they can get up very comfortably, that's will be very, very useful tip for them. And some patients, for some reasons, if they cannot convert in Indian toilet into foreign type of toilet, definitely they can use a foldable chairs or plastic chairs are available, wherein there will be a chair with a hole there, right? So comfortably they themselves can put it on there, and they can sit on the chair itself. Once they finish their defecation, they can fold the chair and keep on come back, right? It will be very, very, very useful one. Definitely those people who can't afford to have a foreign type of latrine, they can use such kind of accessories, right? That's the one thing. Second thing, if they want to sit on the Indian type of toilet, getting up will be very, very problematic for them. Those patients who have the problem, then only they will understand actually, right? It's very difficult. See, they are undressed, and the smell will be there toilet. They cannot ask somebody to their sister-in-laws or their father or their spouse. They cannot ask. Even they cannot ask their daughter-in-laws or son-in-laws to come and help them, right? So what you can do is you can just hang one rope there, right? Simple modification. If you can hang one rope there, and they will catch hold of that rope and they will easily climb up. That's very, very convenient. That's the thing you can do. Or else you can fix some side bars or something like that in the wall nearby to their toilet place, where they can catch hold of it, and they can put the weight on that, they can lift up, right? That's very, very convenient. You can do such small modifications in the toilet room, so that life becomes easy for them, right? So is that if the patient is sitting on a chair, if they have like these armchairs on the side, no, definitely they can put weight on that, and they can climb. I mean, they can stand up like this, okay? Because most of the weight will be put on these arms, on this supportive arms, and they can easily climb up. If there is no arm, then it is very difficult for them to climb up. So let them use chairs which has arm support like that. So most of the patients do ask me, doctor, can't I sit on the floor? Sitting cross-legged is very comfortable for me. See, thing is that if you sit on the ground, getting up will be a problem. You may have to take somebody's help, or you have to struggle a lot. Instead of that, if you sit on a higher place, suppose on a divana cot, if you sit with cross-legged, or if you sit on your bed also, or sofa set also, then it will be convenient. What happens? You will be sitting cross-legged. You can remove your legs and take the help, and your foot touches the ground, and you can arms climb. You can get up, right? So if you sit on those higher platform, then it will be very convenient. That thing you can do it, okay? And as much as possible, as we told, avoid straining of your knee joint, avoid the long-term standing, take breaks in between, and avoid as much as possible climbing steps, all those things, right? If you do these small modifications in day-to-day activities, that will give a lot of relief for the pain of the patient who are suffering osteoarthritis. Along with that, definitely keep your body weight under control. Take care of your diabetes, take care of your calcium rich food, and do quadriceps exercise to strengthen your knee muscles. That's very, very important, very, very crucial, right? So please do have a timetable wherein you have a time to do the exercise, right? Every day we brush your teeth, every day we take bath. Why not do exercise, right? It's very, very, very crucial, especially in elderly people. Other day I was attending one health club when they said, okay, now we have crossed 50, now we are very much aware of our health, we are very much aware of our body. Let us practice all these things, right? So these are the small lifestyle modifications by doing which definitely you can fight back the knee pain, right? Please do follow all these things. It's a very, very important video. You people who don't have the knee pain won't understand the importance of this video. Please do forward it to your parents, elderly people, grandmothers, grandfathers, or your relatives or friends who are suffering from the knee pain. And it will be very, very helpful for them. Definitely they are going to thank you for sending this video to them, right? Please send this video, forward it to your family and friends, which will be very useful. Forward it to your family groups. It will be very, very useful for them. And their life becomes very convenient, and they will give you the blessings, right? I hope all of you want blessings from your grandparents and elderly parents, right? And I have done so many videos like this, more than 250 videos. Please do subscribe my videos. It's very simple. Dr. Muralidhara Ortho. If you type like that, my video channel will come. Please do subscribe it, okay? All the best.